It's a welcome position. I think this is for the...
Although you're the chairman of IATF,
Yes.
but you are sharing the power with others.
Yeah, because the president's position, if I may, with all due respect, is that the overarching principle, one of the overarching principles in our pandemic response is really a whole of government approach. So that I think the wisdom there is if you constitute the IATF through a continuing executive order in 2014 by President Aquino, the President expanded the membership, in fact, from 8 to 34. So it's a full cabinet member IATF policy-making body, again consistent with the wisdom of the President that the DOH cannot do this alone. It will take forever for the DOH to respond to this. So the President, I think his wisdom was to make it easier for the DOH through collaboration with 33 other government agencies to really come up with a pandemic plan where everybody has a significant role to play. So AFP, PNP, PILG, PNP, lahat, no exception. But I concede that there is the law and the grant of powers to the DOH is indeed plenary. But this has been the wisdom of President Duterte that this is a whole government approach, and therefore the constitution of an expanded IATF body is in order to precisely accelerate the pandemic response to its logical outcome, which then we are all enjoying the results of the hard work that the collective IATF has done to deliver precisely the benefits that we all now enjoy. Thank you.
So mga kaibigan, as I told you before, this forum is going to be something different, no? Mga inside stories and all this stuff. Umiinit yung discussion, no? The discussion is going wild, no? Wild. W-I-L-D, wild, no? But the wild, sa sinasabi ko, gusto kong tanungin si Secretary Duque on the issue on the wild thing, no? Sec, since puro COVID yung pinag-usapan natin and the discussion is heating up, no? Let me ask you a question about wild. Let me ask you a wild question. W-I-L-D. Waterborne disease, influenza, leptospirosis, and dengue. Second, can you comment on these things, yung latest na mga ginagawa ng DOH to address this wild concern?
Yeah, this is a yearly concern of the department, and in particular, the leptospirosis and dengue, cases are up every time the wet season sets in, no? And we are in the wet season. So we have heard and seen the numbers go up in several regions with respect to dengue outbreaks, no? And we have already instructed our regional centers for health development offices, our directors, to closely coordinate efforts to control the dengue outbreak in regions like CAR, Region 6, Region 9, and Region 5, and many other regions to ensure that the 4S strategy is implemented by the local government units. The health functions operationally have been devolved to the LGUs. No? So the DOH continues to guide implementation of containment measures, preventive measures, health promotion measures, and treatment capacities, no, of the different LGUs to precisely address the ongoing dengue surge in those regions. No? So yung 4S is really seek early consultation. Deaths from dengue are happening because of late admissions, late consultations. So this can be prevented. Madali lang po ito. Pagka may simptomas sa isang barangay, nakilala, meron nang nakalat ng mga dengue, dahil po na po sa ospital. Meron po tayong detection test, rapid testing dyan. Malalaman natin kung talagang dengue ito. And the supportive, wala kasing gamot ito dengue. Supportive treatment lang ito. So, against fever, paracetamol, dehydration, so yun kung kayo, so isiswero kayo para hindi manuyo ang katawan at para malayo sa peligro, bunsod ng dengue infection. So, yung isang S is self-protective measures. Kailangan hanggang sa mga arin, mahabang pantalon, mahabang manggas na mga t-shirt, iwasan na may itim ng mga kulay na pasuutan. Kasi dyan, ang gusto-gusto ng dengue, dumapo. Dahil alam niyo, may itim yung dengue, with white bands, no? Yan, sa araw kumakagat. Siguro sabihin natin, ang tanga naman ng lamok na ito, dahil bakit sa araw siya nangangagat? Kitang-kita siya kasi itim siya, no? Pero why siya? Tatago siya sa mga madidilig ng mga lugar. Okay? One. Number two, yung dengue mosquito, Aedes aegypti, na-encode na niya yung tinatawag natin blind spots of the human being. Yung blind spot, kakagat siya, alanganin yung likod ng katawan, ng binte, alanganin din gilid. So, doon sa lugar na hindi mo papansinin, no? So, wala na rin sa likod, wala sa harap. Dahil magaling siya, alam niya manago, ano? So, yun ang kailangan talaga maging mataas kamalayan natin. Titigil ka kung saan yung mga lugar na magaling siyang tumago, blind spot ng tao. Pangatlo, yung say yes to fogging, if for 2 weeks meron ng continuing outbreak of dengue. No? And paghuli, search and destroy. Simple, walang gastos, ikaw lang natin ang mga basyo, ang lahat na pwede pamugaran ng lamok at kitikite para maisan ang kalat ng dengue. Out lang, takpan. Ano ba naman yun? Mahirap ba yun? Eh, laking benepisyo at malaking halaga ito, mga gawain na ito, para matigil ang outbreak at maiwasan ang pagpanaw ng buhay, mga bata, ang madalas tamaan, batang lalaki, madalas tamaan ng dengue, lalo sa mga mansama. So, isa yan. Pangalawa, doon sa sinasabi natin, leptospirosis, sa ganun pa din, sinalihan na natin ang mga local government units, yung all year round, yung kanilang flood control projects, no? Kasi dyan, yung wastewater, sa katuparan ng batas, ni Senator Jovia, na dapat ay ang mga baha dahil dyan na effect ng ihip, ng taga, ng leptospirosis, yan ang nakakahawa. So, sa mga tao, kaya nakabota. Kung nagtatrabaho, hindi pwedeng lumusok sa baha na naka-chinelas lang, lalo na kung fungal infection, doon ang pasukan ng leptospira organism na pwede makamatay, no? Tama ng kidney mo, kidney na failure ka dyan. So, ito yung mga preventive measures, no? Kung maiwasan, iwasan. Pero tingin nyo na baha kayo, pumunta na kayo kagad, magkonsulta na sa pinakamalapit na City Health Office o sa inyong Municipal Health Office at handaran mo sila, simple lang gamit dyan, doxycycline, no? Prophylaxis, may actual treatment kung talagang infected ka lang. So, all the measures are in place, no? So, yung mga waterborne infection, yan yan. Cholera, typhoid, hepatitis A, usual, pakuluan lang ang tubig ng higit 3 minuto. Siguro tubig na ang paghahanda ng pagkain, ang pagluluto, tama, no? Mainit, hindi yung malamig, kakainin mo, natapunan ng langaw, galing sa dumi yung langaw, at na-contaminate yung pagkain, umpisa na ng sakit yan. So, lahat itong mga paalala na ito, patuloy na pinamahagi ng inyong department para malaman ng ating mga kababayan ng kahalagahan ng health promotion, disease prevention measures. And in the end, ay lahat tayo maging malusog at talayo sa panganib ng nakamamatay ng mga sakit. Maraming ito, mga sakit na binagyan sa wild ay talagang pwede makamatay. So, hindi na po na.
I don't know if this is serious or light question. It depends on the recipient of the question.
Go ahead,
So, Secretary Duque, many of the cabinet posts have already been filled up. Of course, the assumption will be on July 1st of the new appointees. But the DOH has not been touched as of yet. There are names that are being mentioned as possible appointees or appointee to the Department of Health. Is it possible that you are to be retained? Or if you are not retained, what will you do? You have been in government for some time. We were together. 21 years. Pareho tayo. 21 years. We were together during the first term of Secretary of President Gloria. Then you were with the Civil Service Commission. Then you were back to the department. You were with yes. And then you're back now. Of course, we were under you. When you were under when you were at the helm of the GSIS, we are your tenant on the land where Manila Hotel stands. So, what is the future for Secretary Duque? You see, it's either light or serious. It depends on the recipient of the question. Did I put you on the spot?
Well, this I can say, I am pioneering for good, and I'm going back to the academia. I'm going back to help manage the family-run university in Dagupan and in Daleta City, Pangasinan. So essentially, that's my plan is to shift towards the education sector, academia in particular, teach, incorporate universal healthcare in the medical and allied medical courses so that there's a better appreciation of our students on the principles and policies underpinning the implementation of the universal healthcare. So, the answer to the question is, number one, it is speculative that they might retain me. I mean, I leave that to your imagination, but as far as I'm concerned, I am back. And I'm going back to my city and province of Pangasinan, city of Duque, and that is what the future holds for me. Thank you.
Sec. Before we open the Q&A portion, hihirit lang ako ng last final trivia for our friends here. You know, this is the second time around with Secretary Duque here at DOH, no? And on the second time around as DOH Secretary, one of the first media forum na nag-guest si Secretary Duque on the second time around as DOH Secretary is Kapihan sa Manila Hotel several years ago. Now, the trivia is 2 days from now, si Sec will be going back to the private sector as he said, no? Then kami ulit sa Kapihan sa Manila Hotel yung binigyan ng good secretary natin ng chance to have a take-to-take intimate one with him. Maraming salamat, Sec Picoy. Maraming salamat po. Now, can we open the Q&A? I would like to call first to do the question. our friend from RTN News, no? CNN, sorry, CNN pala. Matanda na ako, RTN. CNN, from our friend Caroline Duque to please ask the first question from the guest here. Caroline?
Good morning po, Secretary. My first question po is, Secretary, may nabanggit na po ba sa inyo kung sino na po yung kapalit? Secretary, and kamusta po yung transition po? May napag-usapan na po ba kung paano magiging transition? Especially we're in the middle of the pandemic po.
Yung papalit, yan ay ipaubayan natin yan sa susunod na administrasyon, si President Bongbong Marcos, may sariling proseso sila sa pagpili ng susunod na Secretary of Health. Ngayon, may mga naliligan mga pangalan, at para sa akin, lahat sila qualified, lahat sila magaling, lahat sila nagkaroon ng pagkakataon tumulong sa ating pandemic response from the policy level to the implementation of the IETF, PDITR plus vaccination strategy. So, I think it will be good for the next administration or for President Bongbong Marcos to choose someone. I mean, this is my humble manifestation. Is yung nakakaalam na kasi they have to already hit the ground running, so to speak. So they build on whatever gains this administration was able to accomplish. No? So it is wise to get someone who already knows what to do. Kung magkalimutan ka ng hindi naman nakakaintindi at kulang sa kaalaman at expertise. No? Baka magka-problema pa tayo. Maganda na estado natin. No? Nakita naman natin, we're all enjoying face-to-face, full transport capacity, full establishment capacities, lahat na. Face-to-face classes will soon go full blast for 2022-2023 school year. So, yun na yun. Tingin ko, antayin lang natin, meron na yan. Hindi naman yan mahirap. But yung proseso, yun ang dinadaanan ngayon yung mga nominees with Convener. Tapos, yung transition, pwede na kami. Tagal na kami ready sa transition. We have 170 policy issuances for the RETR. All we need to do is to give it to the next administration for a committee to study all these policies, make an assessment, evaluate the impact of these policies in terms of implementing, prevent, detect, isolate, treat, reintegrate vaccination strategy. No problem when it comes to the transition. And then secondly, remember that the IETF, which consists of 34 national government agencies, the secretaries will soon leave for the most part, but the deputies, the undersecretaries who are career executives, they will remain. So, wala tayong problema. Basta, sana lang pagpatuloy and build on the gains of this current administration. Salamat.
Secretary, just to clarify, yung sinasabi niyo na sana ang incoming President PPM ay nakakaalam na meaning, nakakaalam, meron ng experience or has been involved in the pandemic response.
Yes.
And you've mentioned may alam niyo po na may mga nominees na alam niyo po kung ilan yung pinagpipilian ngayon.
I'm sorry, I'm not privy to how many. So I can only guess and it's as good as your guess.
And then, next na lang po, Secretary, you mentioned earlier that the President's mandate will only be effective until midnight of June 30. Noon. Noon po, June 30. Sorry. What happens to the current protocols? Like, for example, wearing a mask, IATF mandates, will still be in effect until incoming President Bongbong Marcos decides whether to abolish or retain the IATF law?
The action kasi of the IATF, it is a legal body. It has its juridical personality. So whatever resolutions have been approved by the task force, no, that will continue. But it is in the act of the administration to review those resolutions, and if it deems fit that a review must be conducted of all of these, then it is well within their power to do exactly just that. And then they can amend, and it is also well within their mandate to make whatever amendments are in order or applicable to the evolving situation. You know, in pandemic, we're still in the pandemic. The period of public health emergency will not be lifted until September, okay, because that's the expiration of the declaration of public health emergency, September. So, yun lang.
Thank you, Secretary.
Yes. Next, please identify yourself and the media outlet that you are connected with. Thank you.
Magandang umaga po. Aking pong katanungan ay address
Can you identify yourself and your media outlet?
Ako po ay si Jolan Santos, newspaper man, manunulat po sa literature, book author, at higit po sa lahat ay novelista po sa comics. Ang tanong ko po ay, gusto ko rin po pala idagdag ng aking pong audience sa aking panulat ay mga magsasaka at mga mangingisda, karamihan. Ang tanong ko po ay karaniwang nadidinig ko na natulog ko na po ba, Ginoong Kalihim, ang paniniwala ng iba na ang COVID-19 ay galing sa China. Isa po yan sa tanong. Pangalawa pong tanong ay ang mga naglalaro sa isipan ng mga ayaw magpabakuna na pag daw nabakunahan sila, lalong iikli ang kanilang buhay at magiging zombie. Kaya yan po nadidinig ko po yan na mga tanong sa kaisipan ng iba pong ayaw magpabakuna. Kaya po dalawa po yung tanong ko na yun. Natuldukan na po ba yung mga tanong ng COVID-19 ay galing sa China? Isa po yun. At magiging zombie raw, madaling mamamatay ang mga nabakunahan.
Second is our friends from the social media.
Oh, yes. Magandang umaga po sa inyo.
Hindi lang tayo conventional media dito. Pagkakasanan ng social media broadcasters ng Philippines. We also have social media bloggers here.
Ito lang po ang maiksing kasagutan. Yung po unang mga natukoy na kaso ng COVID-19 ay galing sa Wuhan City ng China. Ngayon, kung ito ba ay sadya na ginawa through a synthetic process, eh wala naman pong ebidensya na nagpapakita na ganoon. So, malinaw ito ay nanggaling sa hayop, no? Yung iba sabi sa paniki, yung bat. No? So, this could very well be a classic example of a zoonosis. Ang zoonosis ay sakit sa mga tao na galing po sa mga hayop, na galing po sa mga animals. No? Sa pangalawang kasagutan, babalikan ko kayo ng tanong. Kayo ba'y bakunado na?
Ako po, bakunado po.
Kayo po ba ay booster na?
Opo.
Okay, then, congratulations. Meron na ba kayong nagsuzombie na kayo?
Ay, wala na po. Kahit kasasaling kasasa.
Okay. So, palagay ko, yan sagot na yan, malinaw na halos 7 of the 7 billion global citizens, no? Mga siguro 60 to 65, 70% na bakunado. Wala pa naman akong report na zombie galing sa isang bansa o sa isang lugar. So, halinawa ay hindi po totoo yung mga pag-iisip na iyan. At salamat po, at least naitanong ninyo at maganda naman na yung mga naniniwala sa teorya ng zombie ay malinawan na po. Salamat. Congratulations.
Thank you very much. Salamat.
Next question from our friend from DOH 7. Silay, all this. Okay.
Good morning, Sec. Sir, it was announced by Malacanang that the IATF revised the metrics for the alert level classification. So, bakit po, why was it revised po?
Well, we revised it. Number one, the answer to your question is yes, we have revised the metrics to guide IATF in its decision whether to escalate within the alert leveling system or de-escalate. Now, we used to have, in terms of direct COVID cases and indicators, tatlong metrics. One is the 2-week growth rate. Tinanggal na natin yun. The 2-week growth rate is no longer relevant at this time. Kasi 2-week growth rate ka, kung 0 case ka, tapos nagkaroon ka ng tatlo, 300% ka agad, high risk ka na, tatlong kaso lang. Anong kalokohan ba? Hindi naman na ito panahon nung wala pang bakuna. Meron tayong bakuna at maganda yung masking rate natin. In fact, ang masking rate natin, sabi ng Johns Hopkins University, nagkaroon sila ng survey from September last year to April this year na ang masking compliance ng Pilipinas, kaya magaling tayo na. Sabi ko sa mga kababayan natin at ng Pilipino, congratulations, ang masking rate natin, 91 to 96%. Kaya ano ba yung differentiator natin na mataas ang, tingnan mo ngayon, ang Singapore, 600 plus per million population ang incidence na COVID nila. Grabe. Kaya na, unahan na natin eh. Alam mo sa COVID-19 recovery index, we achieved 2 quantum leaps. Leap from 121 rank, naging 57 in November last year, and now May number 32. Naunahan na natin ang Switzerland. Naunahan natin ang Israel. Naunahan natin ang Canada, America, New Zealand, Australia, Singapore. Lahat sila, we already outlined them. They are between 40 and 90 rank of the list of countries assessed by the Nikkei Asia. So, again, this is really a testament, first to the President's leadership, and to the IATF, under the President's stewardship, that all the policies na una binakalatan tayo, tama lang. And we are now being recognized and assessed by independent or third-party evaluating bodies. So, ang masasabi ko, yung revision was forthcoming. So, dalawa na lang. Nagamitin natin, average daily attack rate. Kung below 6 ka per 100,000 population, that is low risk classification. Ano yung sinabi ni Senator Joey kanina, sa low risk tayo. 6 to 18 per 100,000, moderate risk ka. Okay? That should be an alert level 2 in the usual understanding of the implications of these metrics, guiding alert leveling system for escalation and de-escalation. And pinaka-importante, healthcare utilization rate. So, healthcare utilization rate natin, less than nationally, we're less than 20%, ang baba. Kailangan maabuti mo ng 50 to 70% niya para kang maging moderate. So, tingin natin, yung dalawang, yun na lang ang most accurate measure of the COVID situation. So, tinanggal na namin yung isa. Para, again, to simplify, para hindi na nahirapan tayo. So, yung dalawa na lang ang ating gagamitin. And hindi rin pwede na, halimbawa, yung agar mo, nag-moderate risk ka. Halimbawa, ang kaso, tumalo ng between 6 and 18 per 100,000 population. Hindi pa rin sapat yun. Titignan mo pa rin yung healthcare utilization rate mo. Kung ito pa, ay pumalo na rin sa 50 to 70%, warranting an escalation to level 2. No? So, ito, we are nimble, we continue to amend if the situation calls for it, no? So, ganun po yung ITF natin.
Next question please, Sec. Sir, kailan po sisimulan yung rollout ng booster for non-immunocompromised 12 to 17 years old?
Well, they're just finalizing the guidelines as we are speaking today. So once the guidelines are finalized, ready for rollout na tayo. So since today is only Tuesday, well within the week, I suppose we can already see the booster dose being utilized for the rest of the 12 to 17 age group.
In relation to that, Sec, Presidential Advisor Joey Concepcion criticized the HTAC for its slow actions. Like, ito pong sa booster, una po, binigay po nilang condition ba na dapat ma-reach muna yung 40% ng booster coverage sa senior citizens?
No, the 40% coverage for senior citizens as a requirement has been retracted already by the HTAC. Because the HTAC was made to understand after some meetings with the NVOC chair, Duque Kapihan, that operationally it's very difficult to make that requirement, to implement that particular requirement. Dapat in that area, babakuna ka ng rest of 12 to 17 population age group, na ang requirement po dapat doon sa lugar na yun, ng senior citizens, at least 40% ng naka-booster. And that's a very difficult requirement. It's impracticable. You can only need to delay. So, nilitrack naman ng HTAC. And with a very good cogent explanation for its retraction. But going back to what one person has been pushing for the vaccination or boostering of 50 years and above, essentially moving the threshold from 60 to 50 years of age. First, the INTF only listens to real experts. Okay? So, let's leave it at that. Yun ang aming pinapakinggan. Lahat ng ginagawa namin, nakita niyo ang resulta, bunso dito ng amin pong consultations, ng 11 panels of experts. So let's listen to the experts kasi the outcomes, the results na aming argue. And a large part of these outcomes is really due to our consistent engagement with our scientists, our doctors, who are always data-driven and evidence-based, science-based recommendations that they put forward to the IATF to shape policy resolutions that will give the best benefit to our people.
Thank you, Prof.
Thank you. Next, our friends from ABS-CBN, PTV5, PTV4, ABC5. Yeah, we have Vivian from
Good morning,
ABS-CBN.
Sir. Good morning, doctors. Vivian Gudia from ABS-CBN. Just going back to a topic we discussed earlier, Sir, yung pagbawi or pagtanggal itong 2-week growth rate bilang basehan sa decide kung moderate risk, yung risk level, COVID risk level ng isang lugar. Recently, meron po tayong mga areas or LGUs sa Metro Manila na ilagay sa moderate risk. Ano po ang epekto nitong pagtatanggal ng 2-week growth rate sa pag-classify sa kanila as moderate risk? Will they be downgraded back to low risk?
Yes, of course. That is the natural consequence of having devised our metrics and doing away with the 2-week growth rate, precisely because the 2-week growth rate metric has lost its significance, has lost its relevance, and to me it's an alarmist metric, and it's unnecessary. So we are nimble, and the INTF listens to our experts, and our experts are of the consensus that hindi na kailangan talaga itong 2-week growth rate. Hindi na ito panahon ng Delta or Alpha and Beta na kailangan mo yung early signals, very sensitive metrics. Hindi na kasi bakunado na maraming malaking porsyento ng populasyon. Maganda yung masking compliance. No?
But given these new metrics, are we saying sa NCR, as we speak, wala na pong moderate risk?
Mawawala na siya. We will just have to look at the numbers again. Removing the 2-week growth rate metric, we will limit it to the average daily attack rate per 100,000 population and the healthcare utilization rate, which are more accurate reflection of the real COVID situation.
The target para ma-moderate risk is at least 6 over 100,000 population. So far, wala pa po.
Wala pa.
Sa Metro, no?
Just wala pa. I think 3 is the highest so far. 3 plus per 100,000 population. So, it's halfway towards reaching the threshold for moderate risk classification, which is between 6 and 80. Once you reach the threshold, then there's going to be N plus a moderate risk healthcare utilization rate equals alert level 2. But we are far from that situation. I hope that that will not happen. Right? But, as I have said, the one major challenge that continues to baffle us is the unpredictability of this virus. And we've seen it, diba? We mutate. Diba? All of a sudden, iba na naman ng kanyang transmissibility. So, yun lang. But we are involved, and that is the one thing very good about the IPF. Talaga it respects science and data and evidence-based medicine in all its decisions.
Another update or clarification on the rollout of the first booster to the general 12 to 17-year-old population. On Thursday, magkakaroon na po ng change of administration. Right now, we're finalizing the guidelines you mentioned. Is it possible tomorrow? Magsimula na kayo?
Well, I will have to defer to the NWOC head, si Yusuf Kapihan, because I really do not know whether they will be able to this. I think they started the finalization of the guidelines. So once the guidelines are out, then they can roll it out. But again, this will be you'll be starting with NCR and hospital-based yung booster shots.
Even for the general, hospital-based only.
Yeah, hospital-based.
And then, I guess yung HTAC kaya sila naglagay ng at least 40% muna ang booster of the general population. Concerns sila about the supply of vaccines. Kasi Pfizer pa lang rin ba yung allowed to be vaccinated or administered as a booster.
Na sila magbabayad kung ano man ang kanilang na pahintulutan na bayaran. Ano? So, Manila. So, kami we're doing our jobs. Part of our governance, part of the accountability that goes with public service. No? Kaya gano'n. So, nakikiusap kami sa lahat ng mga directors, sa lahat ng mga chiefs of private hospitals and some LGU hospitals, magpadala na po kayo ng liquidation report. Di ba? Sabi nga sa akin ng director ko sa NCR, kahit na partial liquidation report, pwede na. Basta mapaliwanag sana punta yung pondo. Kasi pondo ng taong bayan. Ano po? So kailangan na sakto-sak. Kailangan alaman kung saan ginastos, saan kanino binigay. Ganun ang COA, ganun kahigit po ang COA. Gusto na po namin ilabas lahat. May pondo naman ang COVID allowance. Naglabas ang DBM na 7.9 billion pesos. For January, February, one COVID allowance or OCA. Pero kung wala naman liquidation, anong basis natin? Maliwanag po yan doon sa atin na memorandum of agreement with these private hospitals. Yun lang po.
Sec, just your thoughts po doon sa sinasabi ni Digran naman na several hospitals have increased their rates by around 5 to 10% to the rising cost of basic commodities. Your thoughts on that? And what are we doing to address this?
Well, the PhilHealth, okay, I don't know if PhilHealth will have the material time to review its rates, no? Because this will impact on PhilHealth. So PhilHealth will have to make some actual actuarial studies or computation to see if yung adjustment na ginawa ng mga hospitals kaya sabayan ng PhilHealth. Kasi kung nataas ka ng cost mo, yung mga benefit packages mo for the members, automatic yan. Mag-i-impact yan doon sa reimbursements ng PhilHealth. Either really yung support value ng PhilHealth o mag-desisyon ng susunod ng PhilHealth leadership and the board na i-adjust to cover for the increases that have been implemented by these hospitals. But that is a question best answered by PhilHealth.
Sir, one last update po sa ating expiring vaccines.
The expiring vaccines as of the last report to me was about 4.7%. So the WHO allowable wastage, vaccine wastage is 10% of total received doses of vaccines.
Yes, can you identify yourself and the media outlet?
Good morning po, I'm Mark Fetato from KTV4. Based po sa bulletin ng DOH kahapon, nasa 500 plus po pa rin yung number of severe and critical cases. However, tumaas naman po yung bilang ng mga namatay sa 51, wherein sa June 20 bulletin po ay nasa additional 6 lang po ito. Ano po yung explanation dito ng DOH kung bakit nga po tumaas yung number of deaths, and baka po kasi ito ng panic sa tao. So, para lang din po hindi ma-misinterpret.
Well, we will have to look when those deaths actually happen. Because a lot of it did not happen just a few days ago. Some of them are submissions from the LGUs. So this could have been deaths from prior weeks, no, or prior months. No? So we will have to see. But nakikita namin, overall, bumaba ang ating mortality rate. So in fact, sabi ko nga sa June, parang ilan lang sa June? 3 ba? June 1 to 26, what's the mortality rate? Let me just check. Oh, I hope you don't know. June, tatlo lang. Oh, yun. So, yung report na yan could be a delayed submission of reports na.
Second na lang po, ano yung reminder natin sa mga dadalo sa inauguration po ni President-elect Marcos?
The same, you know, as we have always reminded the public, yung public health standard. Kung sino mga nagpupunta doon, mag-mask pa. Alam naman niyo, dami ng super spreader events na nagdaan, di ba? Eleksyon, Ramadan, Holy Week, caravans, rallies. Hindi pa nga nag-uumpisa officially yung campaign period in on February 8. Ang dami na prior caravans, di ba? Yung mga motorsiklo na kilometro haba, o nag-reflect ba sa number of cases? So hopefully, dahil ng mga tao, marunong na, tama pagsuot ng mask, naiwasan natin ang hawakan. So, patutuloy po natin yung best practice natin.
Next, can you identify yourself?
Yes, po.
Good morning po, gentlemen. Mendoza po from the Manila Times. Sec, clarification lang po. Doon sa sinabi niyo po na tatanggalin na po yung 2-week growth rate and doon sa mga metrics po natin sa alert level system. Ibig po sabihin, kahit na po mag-moderate risk yung ADAR natin, pero low risk pa rin po yung hospital utilization rate, still alert level 1 pa rin po yun. Okay. Second po, yung criticism po sa HTAC ni Secretary Concepcion, kasi po parang sinasabi po niya, or equivalent sa sinasabi po ni Secretary Concepcion is, the HTAC is the one delaying the policies ng pagbabakuna sa Philippines. And I think sabi din po ni Secretary Concepcion na dapat daw ibigay daw po sa FDA DEP yung decision na i-administer yung mga bakuna sa mga population natin. Sir, what can you say about dito sa proposal or sa binatig right ni Secretary Concepcion na ang cause of delay daw po ng pagbabakuna sa ating bansa ay sa HTA? Yung cause of delay po nung parang bakit po ang delay daw po yung bakuna sa stock tapos sa araw po gagawa ng guidelines. Dapat po yung ano na daw po, dapat na po ma-aprubahan na buhay ng BP, dahil sa aprubahan ng BEP, i-roll out na po ito kagad. Wala na po kailangan ng stock approval.
Eh, naayon tayo sa batas. Hindi naman pwedeng whimsical na ang HTAC mag-recommend na walang batayan. So, HTAC's recommendations are based on data, based on current real-world data, clinical trial data, on effectiveness, safety, and quality of these vaccines. No? So, we have to respect these HTAC because these are the authority, they constitute the council of unassailable expertise. So, we cannot be deviating from what the law clearly stipulates, that if it is, if you roll out something, HTAC should give the recommendation, and the law is very clear. HTAC has good recommendation, and WHO pa recommendation. Okay, so unless those two requirements are satisfied, it will be difficult for us to roll it out without possible legal consequences. And we don't like that. That will create more doubts in the minds of our people. So it's better to be prudent, always, to err on the side of caution, you know. And we'll reiterate, we listen to experts, not to pseudo experts.
Okay. So anyway, last question, no? Because the secretary has an appointment pa.
Yeah. Last question na lang.
Thank you, Red. Thank you.
Last question na lang po, Sec. I know that you are now in your last few days of your term, Secretary. Na-explain na po ito kanina that you have na-prepared na po yung documents for transition. Pero are you worried na hanggang ngayon wala pa rin napipiling health secretary si President BBM? Or are you satisfied po sa ibibigay niyo pong mga documents sa susunod na health secretary, whoever that may be?
Well, let's leave it to the to President-elect Bongbong Marcos to choose the best possible next Secretary of Health. Okay, and we leave it to his judgment. Have a process. We have to respect the process. Hindi mo makuha sa madalian yan. Kasi, syempre, hindi naman madali itong situation natin ngayon. We're still in the state of public health emergency. And then, pangalawa, wala namang problema because the documents are all there. The transition plan is there. All we have to do is to turn over this to them, then for them to create a committee that will evaluate these documents, and then they will do an impact assessment. If some of these policies have proven to be effective, then they probably should build on it. If some policies they think are weak, then they need to improve on it. Eh, ganun lang talaga yun, di ba? Kanya-kanyang panahon, but do not scrap the gains of the past administration. Because we did not scrap the gains of the previous administration. My sense is that it's best that they continue so that our people, in the end, ang targeting tama, not the innovation. Just like you and me now, we are benefiting from the outcomes of all of the policy decisions that the President and the IATF have made. So,
Thank you very much. No? So we will, sige, Lay, last.
Sir, I heard that you gave an infinite farewell to DOH employees yesterday. Ang question ko lang po, you served twice as DOH Secretary. How do you want to be remembered po by the Filipino people?
How do I want to be remembered? Well, I guess it will be difficult not to remember me as the pandemic secretary of health. So that's about, the question is how did we do? And the Nikkei COVID-19 Recovery Index is a third-party assessment body that has ranked us ahead of many richer, powerful, resource-rich countries. We outrank them. And this fight is a marathon. It's never a sprint. It's not a 100-meter dash. talagang pinag-aralan, isipan, talagang pinagkaisahan ng ating RTF, consistent with our whole of government and whole of society approach in dealing with this pandemic, on the one hand. On the other hand, we continue to be challenged by the implementation of the universal healthcare law. Okay? So that is now cut out for the next administration. We deliver on some of the provisions of universal healthcare law, but it is a long journey to cover. More ground needs to be covered, and so I'm confident that they'll do it. The law is clear, and going back to that question, I never really bothered about how I should be remembered. I think that's the least of my concerns. So I just want to retire. I just want to let people know that I tried to do my best. There was never a time that I did not give out my best. Having served as a Secretary of Health twice, I have used all my past experiences in helping shape the policies that underpin our COVID pandemic response, which in turn were foundational to the implementation of all our PDI/PR plus vaccination strategy. So I've poured all God-given talent, knowledge, dedication, commitment. But this is all really nothing compared to the sacrifice of our healthcare workers. So I am, in fact, a little bit embarrassed to even think about how should I be remembered. Let's remember all the sacrifices of our healthcare workers who have been at the front and center in this pandemic response. And I stand I have no words to describe our sense of gratitude and appreciation because of the way they cared for our COVID patients, the way they treated and saved lives. All our doctors, Dr. Mike, Dr. Benito, Dr. Raymond, all the nurses, all the medics, all the lab techs, all the barangay healthcare workers, everyone, no exceptions. The midwives, everybody had a role in this. Everybody had a humble building block that has contributed to the overall pandemic response. And now we are vindicated by the results, no? Third-party assessment bodies are saying, even Okta in its survey showed 83% approval rating of the government's pandemic response. And in the same survey, 91% of people are willing to, are supporting vaccination program of President Duque. So, Nikkei Asia has commended us as one of two countries with the most significant improvement in the rankings, based on transmission, low infection, good transmission control, loosened social mobility, and a relatively good vax rollout. So yun na po, I rest my case. Kasalaman natin, tandaan natin ang lahat ng mga healthcare workers na talagang nagsakripisyo. Forget about me, I'm not the guy.
Sir, what message did you give the DOH personnel yesterday who really stood by you through the challenges of the past 2 years?
I profusely thank them because their conviction, their belief in me never wavered. So I could have not done what I have done without the DOH as a cohesive agency or organization that is steeped on the values of good governance. That has been my advocacy from the very start. Good governance, very, very important. It's very difficult for an agency beset with too many problems of this pandemic, if it is not united and it doesn't have a clear understanding of where it wants to go, and the implementation of good governance mechanism. Good governance is not just about accountability and transparency. Good governance is making sure that you deliver on your mandate. And this is framed by whatever targets that you adopt as an institution and benefiting the public at large. Because otherwise, we are all nothing. At the end, it will not benefit our people. So we are just instruments. No? So I thank the entire DOH family for allowing me, for helping me serve twice. And in both occasions, I would like to believe that we delivered for the benefit of the Philippines. Thank you.
Thank you very much. So, congratulations, sir. And thank you very much from all of us. No? So, last word from the PMA President and former President, Dr. Olarte. Then next, Dr. Benito Atienza.
Yes, I do believe that we partner with Secretary Duque. I still remember when I was the Secretary General. For the last 6 years po, we are doing our partnership with DOH at sabi ko, the PMA, hindi po namin iniwan si Secretary Duque. We supported him all the way.
Well, maganda naman ang pamamahal ni Dr. Francisco Duque sa ating pandemic health problem. To think about that this is an enemy, the viral enemy is unseen, and hindi pa natin masyadong hindi pa namin napag-aralan ito sa eskwelahan ng virology. No? So, talagang bagong-bago ito. But Dr. Francisco Duque gave us a good administration and management of the COVID-19 problem. Now, as President also of the Clean Air Philippine Movement, I, of course, encourage everyone to help clean our environment. No? Ang ating hangin ay dapat malinis. Karapatan ng bawat Pilipino makalanghap ng malinis na hangin. So, let us make sure that our cars, mga ginagamit nating mga motorsiklo, iba-iba pang mga motor vehicles ay hindi bumubuga ng maitim na usok dahil 80% of air pollution is from the cars, the transportation that we use every day. Let us maintain our cars in tip-top condition para hindi ito bumubuga ng maitim na usok. Dapat walang usok kung malabas sa ating sakyanan. Maraming salamat po sa inyong pagpunta at pagtanong ng mga magagandang questions sa amin.
Sir,
this has been a very good exchange of ideas and hearing the views of our Secretary of Health. Congratulations once again, Secretary Duque and the rest of your team. Congratulations also to the head of Oplan Kalinga, the head of the Office of Civil Defense, the vaccination czar, General Calves, and all your panel of experts, the whole of government and whole of the society approach that underpin the executive order that was continued by President Duterte. The IATF was a creation of the previous administration, carried out, continued by the present administration, expanded, and I hope that this can be institutionalized into law, amending that 11332 Republic Act 332, so that in case, and hopefully it does not happen, a new pandemic arises, a new world pandemic happens, we have a permanent body that had learned from the experience of IATF for the last several years, institutionalizing already with the DOH on top of the of the third pole of the organization. After all, that's in the 11332. It's really DOH and IATF. The head is still the DOH, so it does not really change much. But if there's a permanent body, we don't have to create another. But authorizing the president to make some changes as he deems necessary, but it's already in the law. So no need of emergency powers when there's a declaration of a public health emergency. The system already is in place. So we don't have to wait for Congress to do this and do that, etc. So I think that's one great idea that we can pursue with the incoming administration. So maraming salamat po sa inyong pagdalaw dito sa Kapihan sa Manila Hotel in cooperation with the Kapisanan ng Social Media Broadcasters ng Pilipinas. Maraming salamat, magandang hapon, sir.